Okay, let's dive right into this. Welcome to today's explainer. Now, we're going to be unpacking a condition that is incredibly common, yet, it rarely gets discussed with the openness it really deserves. We're talking about prostate cancer. It is a deeply personal and, let's be honest, often intimidating topic for a lot of men and their families. But here's the thing. By looking closely at the actual medical data, the real risk factors, and even the debates experts are having right now, we can replace all that fear with solid understanding.
So, here is our roadmap for today. We'll cover 1. The silent crisis. 2. Uncovering risk factors. 3. Diagnosis and tests. 4. The treatment dilemma. 5. Side effects and care. And finally, 6. Expert advice and warnings.
All right, let's kick things off with Section 1, the silent men's health crisis.
To really wrap our heads around prostate cancer, we first have to grasp its immense scale. In the US, for example, it's actually the most common cancer among men, right behind lung cancer. And just look at this wild number. Between 1973 and 1993, recorded cases spiked by a massive 173%. Now, to be fair, it's important to know that this huge jump was mostly because we invented newer, better diagnostic methods that allowed doctors to actually catch it. But even with all those amazing advancements, the disease still frequently goes completely undetected.
And honestly, autopsy data reveals just how stealthy this can be. It's actually kind of shocking. 1/3 of men who passed away at the age of 50 actually had prostate cancer and literally never knew it during their lives. And it gets crazier. By the time men reach age 80, a staggering 75% of them have this cancer. So why does it go completely unnoticed? Well, in 9 out of 10 cases, the cancer stays completely silent. It just slowly grows over the years without showing a single symptom.
Moving right along to Section 2, uncovering the risk factors.
Knowing how common and silent it is, you might be wondering, okay, who's actually most at risk here? The exact cause is still kind of a medical mystery, but researchers have found some really significant links. First up is age. It mostly affects guys over 55, though they often don't actually get diagnosed until around 70. Genetics and hereditary factors are a huge piece of the puzzle too. But here's where your lifestyle comes in. A Harvard University study deeply linked prostate cancer to high-fat diets, specifically pointing the finger at dairy fats like cream, butter, ghee, and cheese. On top of that, testicular function plays a direct role. We know this for sure because the disease is incredibly rare in intersex individuals, but on the flip side of that, the risk actually goes up for men who have had a vasectomy.
That brings us to Section 3. Diagnosis, exams, and tests. So if you're in a high-risk group, getting diagnosed is obviously the crucial next step, right? But man, this introduces us to one of the most intense debates in modern medicine. The medical community is completely split on how to handle screening. On one side, groups like the American Cancer Society and the American Urological Association are urging every guy over 50 to get annual screenings to catch it early. But over on the exact opposite side, Canadian medical experts are pushing back hard. They argue that aggressive testing doesn't actually increase a patient's lifespan at all. Instead, they warn it just exposes guys to the severe, lifelong risks of totally unnecessary surgeries.
Now, if a patient does decide they want a test, there are 2 main ways to do it. The traditional, physical route is the digital rectal exam. But honestly, this method is pretty fundamentally flawed. A doctor's finger just can't reach all the boundaries of the gland, and early tumors are usually way too small to even feel until they've already spread. The alternative is the PSA, or prostate-specific antigen blood test. This one is way more reliable. It can detect the disease with up to 60% accuracy simply by measuring specific antigens floating around in the blood.
To figure out if a PSA level is actually in the danger zone, doctors do a little math. They divide the amount of antigen by the physical size of the prostate to get a per-gram measurement. If those levels look suspicious, a biopsy is the absolute mandatory next step. A specialist, a urologist, uses a very specific needle to pull out a tiny tissue sample. They send that off to a lab to look at under a microscope. Really, this is the one and only definitive way to confirm if cancer cells are crashing the party and to see if they've spread.
Which leads us perfectly into Section 4, the complex treatment dilemma.
Okay, so what happens if a biopsy comes back positive? The patient is instantly thrown into the toughest phase of this whole journey, deciding what on earth to do next. Just like with the screening debate, opinions on treatment are totally divided. Some doctors firmly believe the treatment is worse than the disease. Because prostate cancer can stay super contained and grow incredibly slowly over years or even decades, a lot of doctors suggest something called watchful waiting for early stages. Basically, they just keep an eye on things so the patient can live a totally normal life without interference. Other doctors, though, argue for immediate medical intervention to take out the threat entirely.
And that takes us into Section 5, Side Effects and Advanced Care.
If a patient does choose medical intervention, they absolutely have to be prepared for the physical realities. Radical surgery takes out about 90% of the prostate. It immediately stops sperm production, brings a 40% risk of impotence, and a 5 to 15% risk of urinary incontinence. The good news? Newer nerve-sparing techniques are starting to offer much better outcomes to prevent some of that damage. The other main option is high-energy radiation, which is a solid choice for weaker patients. But it carries a 50% risk of impotence, a 3% risk of incontinence, and get this, it can actually leave 40 to 60% of the cancer cells alive inside the body.
Now, if the cancer isn't stopped and it manages to spread to the bones or other glands, doctors have to shift to advanced care. Since prostate tumors literally feed on testosterone, the #1 goal is cutting off that fuel supply. They do this through an orchiectomy, which is the surgical removal of the testicles, or through intense hormone therapies that basically neutralize the testosterone. And yeah, while these do stop the tumor from growing, the side effects are really rough. Patients deal with a complete loss of fertility and libido, plus intense hot flashes, dizziness, nausea, and diarrhea. There are anti-cancer medications too, but those also come with some highly uncomfortable side effects.
Finally, let's wrap up with Section 6, Expert Advice and Final Warnings.
Trying to navigate this whole medical landscape is seriously daunting. But because these treatments are so complex, fiercely debated, and literally life-altering, the absolute best piece of advice you will ever hear is this: never ever settle for just one opinion. Always go out and consult a second or even a third medical expert if their advice differs. And remember, taking a beat to carefully talk with multiple doctors and make a truly informed choice, that is not going to reduce your chances of a successful treatment.
But while you absolutely should take your time deciding on a treatment, here's the big warning. You can never ignore the symptoms. Look at this chain of events. Whether it's an infection, just an enlargement, or actual cancer, if the prostate creates a blockage, it stops urine from flowing normally. That creates a dangerous urinary back pressure. And that constant pressure, it pushes right back up into the body, destroying kidney cells, and eventually leading to total kidney failure. Being lazy or embarrassed about getting checked out can quite literally cost a guy his kidneys.
So we have covered a lot of ground today. We walked through the hidden statistics, the dietary risks, the intense medical debates, and the really tough realities of treatment. The information is out there now, but information requires action. Knowing these silent risks and the severe complications that can pop up, have you, or the men in your life, sought a second opinion yet? Please, don't let silence be the reason a manageable condition turns into a full-blown crisis. Take proactive control of your health today.